Good afternoon, strategic management class 670. This is Ben Phillips. I'm on my final project here. I have a good friend of mine, my best friend, in fact, Joel Cochran, who is a
Hello.
successful entrepreneur. He's on his second business. He's an investor and a fitness coach.
hmm
And I've asked him today to ask me a few questions so that I can show you how I'd like to apply the one piece flow from our lean production system into content creation, how we can use that from our personal brand and our business brand and kind of scale the options on different platforms. So the intent is to use this piece right here to distribute it amongst 5 platforms: YouTube for the full length long platform, LinkedIn for more of the professional side, Instagram to get your name out there. Pretty much everybody's on Instagram. Chop it up into a Twitter feed and then use it on TikTok, maybe make a funny face, something like that. We don't know. But at any rate, I've asked Joel to ask me a few questions and I'll use that content on those platforms. So without further ado, here we go.
All right. Well, I'm glad I get to be the interviewer. You're the interviewee.
That's right.
Um, so we'll start off. Tell us a little bit about yourself. Who are you?
Sure. Absolutely. So my name is Ben Phillips. For those of you who I haven't yet met in class, just about 35. I am a father of 3. I live in the San Francisco Bay Area with my wife and kids. I am the director of operations for internal medicine, family medicine, pediatrics, as well as a network of physicians in Northern California for a nonprofit healthcare organization. I love my family. Love the work that I do. I'm active in my community. And I also, within the last year, started a real estate investment company called GEM Investment Strategies. That's JEM, not GEM. And that's actually an acronym for the name of my children. So pretty excited about that. Excited to wrap this school year up, wrap up my MBA program in July, and then can kind of dive a little bit further into some of those other endeavors.
Nice. How long have you been working in healthcare?
I guess it depends on how you look at it. I got my first personal trainer certification in 2007, which would be about 13 years. Formally in the healthcare field, I've been in just over 10 years, focusing predominantly in primary care, but I also worked in behavioral health for about 3 years.
That was back in Reno.
That was in Reno. Yeah, I ran an 18 to 21-year-old youth parole, kind of like a halfway house program. We called it community reintegration. I also oversaw 4 therapeutic level youth foster homes. What that means is all of these children that were placed in our care had some, at the time, ICD-9, and now what we call ICD-10, mental health diagnosis that required just a little bit more care um, to be provided. So we worked a lot with a behavioral health therapist as well as a psychiatrist when needed to manage medications. Good point. A lot of learning things. I've learned a lot through that opportunity, and kind of segued into other things. So, yeah,
Talking about you segueing into your current career.
sure.
Uh, what's what's your role in that? And I guess how did the you kind of preluded into you've been in healthcare for 13 years. How did the stops before this help where you're at now? So what's your role currently now, and how did the two different careers before that help to play into it?
So, I mean, I come from a family who's been in healthcare. My mom's a nurse by trade. She's been a nurse her entire career, just retired. My uncle was an orthopedic surgeon.
Mm,
My grandfather was an orthopedic surgeon, and so a lot of the dinner table conversation was healthcare related stuff. My family was also super active physically. I mean, I grew up, playing a ton of sports. My mom was active in, skiing and outdoor activities. My dad was a runner and a lifter, and had always just been involved in activity. So from a young age, I kind of got one side of the conversation, which was formal healthcare structure, physicians, hospitals, business, and
mm,
the other side of it
mm.
was just activity, right? And I fell in love with activity from a young age. You and I have bonded over several different sports. And so in my younger years, I thought I was going to go to school and become a physical therapist. I loved that aspect of training athletes specifically, and got into personal training and was actually turned off a bit by the sales aspect of it. I really enjoyed working
Mm.
with people. I enjoyed seeing the progress that they made. I enjoyed the interpersonal interaction and the success that could be achieved on their own. But I didn't like feeling like a salesman, right? Now, fast forward 10, 15 years, I understand the importance of the business behind it. But at the time, I was just a little bit too naive to see the two of them, and kind of transitioned out of that, not really sure what I wanted to do. and it was asked by a mutual friend at the time if I enjoyed working with kids. And, I had started coaching the very first sport that I coached. I was 18, it was youth football.
Oh yeah.
And,
That's right.
yeah. And so I was asked if I liked working with kids and would I want to come work with
Mm-hmm.
kids who had some developmental disabilities. And I thought, sure, why not? And so that's kind of how I segued from fitness into traditional healthcare. And, when I moved to the Bay Area in 2012 to pursue the relationship with my wife, um, I applied for whatever I could get, right? I was just looking for a job in the healthcare space. So I applied for, I don't know, over 50 different jobs, ranging from the insurance side of healthcare to traditional healthcare operations, which is more of what I do now, into software. I applied for a job as an electronic medical record implementation analyst, and that's the one that I got. And so I came over here and kind of was given the keys to a car, that now go drive all over the place and train these doctors on how to use this system. And I've been very fortunate to have mentors along the way that have opened the door to teach me the book of business and show me how different things operate and kind of connect what I think some of my internal passions are, which is health and fitness and longevity, into how we provide some of those tools on a macro stage for the general public, and have kind of blended those. So now I sit as director of operations for an organization that cares for almost 1 million patients collectively. But the community that I serve, we probably serve upwards of 100,000 patients. And it's pretty unique. It's cool to see how we can come together to provide a service offering for community, and then really see what those needs are. And even see how the tentacles go out into things like what you do, which is, probably where the meat and potatoes are done, is coaching and the one-on-one individual work that doesn't happen in the doctor's office or in the hospital, right? It happens in the many hours of the week outside.
So if you were going to explain your role to your kids, how would you explain that role?
I help doctors see patients.
Okay. Because there's times where I'm like, wait a second,
Sure.
what's your role again? Well, you went from this to that to where? And
Right.
people
Yeah.
will ask me just like, so what's Ben doing? I'm like,
So to our community age people, I would say that I work in healthcare operations. I think that's kind of a universal understanding, but really what that means is we make sure that everything is teed up: the real estate, the buildings, the employees, the people you call on the phone, the virtual space, the EMR, the websites, the access to the physician is all set up such that when you want to go see a doctor, everything is seamless, right?
So you're creating the pathway to the doctor.
That's correct.
All right.
I'm a pathway creator.
You're a pathway creator. See, there you go. Now we know. I just find it so interesting because in the medical field, like there's so many different words, like you said, EMR. I don't know what EMR is, right?
Yeah.
There's so many different words. Like you're almost pulling a Brian on me,
Sure. Yeah. And that's my fault. It's electronic medical record.
Okay, that's right. Which totally makes sense, right? But it's just one of those things. Like you get into the medical field, right? Just like you kind of get into the real estate realm, which we'll touch here in a sec. Sure. And it can become very confusing. And one of the things, like Uncle Al always said to me, if you can't explain it to a 5-year-old, then it's too complicated, right? And because if you can explain it at the most simplest way, then everybody is able to go oh, I know exactly what's going on, So
for sure.
But the segue into that, right? Because I know our time is short. Is you also, as long as myself, got into real estate. And so that's an interesting tie-in terms of medical field and real estate. Sure. What's the reason that you kind of got into real estate, and just kind of tell us about that venture and how long that's going to go, if you see that long-term or short-term or whatever the case is.
Yeah, absolutely. Well, as you know, you tipped me off to kind of real estate investment. And you mentioned Brian, a good friend of ours and colleague, Brian Minow, who's been kind of a mentor to me, at least. There was some opportunity that you had mentioned outside of both of the state. I live in California, you live in Nevada. There's some opportunity elsewhere to invest. And at the time I'm finishing up my MBA. I was taking a financial accounting class, right? And we're learning about assets and liabilities and what those things do. And so it piqued my interest. It was something that outside of my earned income or my day-to-day job was something that I thought, wow, I don't have any assets. Like, what are assets and what are liabilities, right? And I think Robert Kiyosaki, who wrote Rich Dad, Poor Dad, puts it best: is assets put money in your pocket, liabilities take money out of your pocket. I thought, wow, although I've been fortunate enough to purchase my own single family residence, that takes money out of my pocket every month. It doesn't bring me money. Like, wow, I don't have, you know, credit card bills. We don't have any car payments. We don't have any other liabilities aside from general, you know, expenditures of food and utilities and stuff. But I also didn't have any assets. And so I started thinking, well, I love healthcare, but for the most part, people don't make a strong living in healthcare, right? I mean, even doctors nowadays make oftentimes less than people, your general engineer in the tech sector. And I thought I need to diversify so that I can continue to create some wealth just in case I die or if my wife dies or something, that I have something to do, something to produce and give to our kids. And that's kind of the impetus for that. So, you know, I've been working with Brian and was able to create Gem Investment Strategies, which for the most part was created to hold my own real estate. And over the last few months, I'm starting to branch out to get to the point of being able to partner with others and invest with people that are interested in getting into real estate themselves.
Yeah, it's been fun.
It has been fun, indeed.
A little scary.
A little bit scary. I mean, we're smack dab in COVID-19, right?
Yeah.
Potentially the greatest recession or depression being compared to since the Great Depression. So we'll see.
Yeah. So it's going to be interesting. Well, thanks for filling me in on that information.
You're welcome. All right, I gotta go. 1 o'clock. Thanks, man.
All right,
let's see. Let's close it out. Let's close it out though.
Okay.
I can edit that part out.
Yeah, we can. What do you want me to say?
Just say, wow, that's, you know, I mean, just close it out. I appreciate you taking the time. I know we're getting this thing set up for your class, but it's been interesting. Yep. You know, where can people find you? Whatever.
Yeah. All right. Well, that's awesome. Thank you for sharing all that information, even being your best friend. That was informative. Closing it out, what's the best way for people to reach you if they want to talk about anything that they heard today?
Yeah. So I think, well, first off, thank you for taking the time to sit down and interview me. I know being my best friend, you're willing to do these things, but the millions of people that are going to watch this don't know that. Right.
That's right.
But the best way to get in contact with me is probably LinkedIn. I mean, that's where I'm most accessible. I have an Instagram, I have Facebook and all that, but Benjamin F. Phillips on LinkedIn. I think it's Benjamin F. Phillips on Instagram. But interested to take any questions. Look forward to working with y'all. Let's do a TikTok now. Do a TikTok. Let me see some of that dancing. Come on. What do you know? All right, man. Appreciate your time.
Right.
I'll talk to you later.
Okay.
Bye.
Bye.